Hey, hello everyone, and thanks for joining us today to learn more about the work we're doing with um, to create a guide for environmentally sustainable practice in primary care. I'm just going to share my screen. There we go. So the past few years have made it really clear that climate change is affecting people in many ways right here in our own communities. Healthcare workers are seeing the immediate health effects resulting from climate-related effects. And the silver lining to all this, though, is that it's caught people's attention. Climate change is no longer a fringe topic. It's now widely accepted that it is a real and immediate threat, and we actually need to do something about it soon. People seem more open to talking about climate and thinking about solutions. A recent survey of health professionals found that 96% of them felt that climate change is important and that we in healthcare really should be doing something about it. And we really should, because even though we have a mandate to protect health, the healthcare system itself is part of the problem, contributing about 5% of total greenhouse gas emissions, both in Canada and globally. So how do we reduce our environmental impact but still provide care? The concept of environmentally sustainable healthcare is defined as care that meets the needs of today's patients without compromising the needs of patients of the future. That means that with every action, we need to consider the effect we're having on the environment. But the great news is that, as you'll see, environmentally sustainable healthcare is not only good for the planet, but also good for patients, payers, and for us as providers. The first step is to better understand what part of our system has the greatest impact. For many of us, when we think about environmental action, we typically think about things like getting rid of plastic waste or bringing in recycling programs. We think about the garbage we see and the energy used in healthcare facilities themselves. And all of these things are really important. Much of the environmental work in healthcare has been directed towards these targets, mostly in hospitals, and often involving large infrastructure projects to improve energy efficiency. But in healthcare, these things, the things that happen within the facilities themselves, account for only about 20% of our footprint. 80% comes from the upstream supply chain of products used to deliver healthcare. In primary care, almost half of our footprint comes from the medications we prescribe, and another 13% from meter dose inhalers alone, which are so bad that they get their own category. So although we tend to focus on the garbage we see, it's important to remember the hidden upstream environmental impact of every investigation we order and every medication we prescribe. For example, let's walk through the process of what happens every time we order a simple lab test. Patient drives to the clinic and then to the lab. At the lab, a number of different supplies are used: needles, tubes, syringes, tape, armbands, and other materials, most of them single-use disposable, and almost all of them need to be disposed of in biohazardous waste. The lab then may need to use a refrigerator for storage or a warmer for culture. And in many locations throughout the province, the sample is then transported across cities, towns, and even provinces to a testing facility to be processed. The testing facility will also require use of supplies to analyze, store, and then dispose of samples. Think about the amount of material and packaging for each simple home COVID test that we've been using. Once the results are ready, there's follow-up, either a phone call or an office visit, and then often more investigations, testing, or referral. And this last slide represents the resources and energy used to extract the raw materials, process, manufacture, package, ship, and ultimately dispose of each product or sample that we order. Although this example looked at a lab test, a similar process is required for every medication we prescribe as well. This example helps us better understand how much upstream environmental impact we can have with every simple action in our day-to-day practice. So far, there are still relatively few resources available to raise awareness about this issue and to help healthcare providers make the shift to more sustainable practice, particularly in primary care. So the Division of Family Practice has generously agreed to support the creation of a guide to help make it easier for family physicians and others in primary care to think about these ideas and make some changes in their day-to-day practice. And the key is making the sustainable choice the easy choice. We recognize that everyone has enough on their plate right now and no one needs extra work. But the beauty of many of these changes is that they can actually make our lives easier and our workloads lighter. We're using the framework created by the UK Centre for Sustainable Healthcare, and it talks about 4 general ways we can reduce our impact: prevention, patient self-care, low carbon alternatives, and I'll start with the one I think is most important: lean service delivery. According to this study by Kai and others, about 30% of what we do doesn't benefit patients at all, and another 10% is actually harmful, both to patients and to the healthcare system. For me, this statistic represents so much opportunity for improvement. This unnecessary care is also referred to as low-value care or overuse of healthcare resources. Low-value care comes in many varieties. Overdiagnosis is one of the most common. When we diagnose a condition that doesn't lead to any health benefits for the patient and potentially leads to harm. This can happen as a result of overscreening, such as with PSAs, or diagnostic creep, where lower thresholds and pre-diseases are diagnosed without any benefit to patients. This slide shows some of the many conditions that we commonly overdiagnose, which I found interesting because many of them were new for me. Overtreatment in its many forms also falls in the category of low-value care. Part of the problem with low-value care is that it can also cause harms, sometimes more subtle than the obvious adverse effects of a test that we usually think of. There are other harms, both for patients and for the healthcare system. Imagine these couple examples. Greg, a 57-year-old male who asks you for a PSA test because his neighbor had prostate cancer. An elevated PSA leads to biopsy and then a diagnosis of low-grade cancer, but because he's uncomfortable with watchful waiting, he proceeds with surgery, which then leads to complications and ends up having some negative effects on his life. Another example is a young woman who is worried about MS, and so she asks for an MRI, which you do, and then they find an incidental finding of an intracranial lesion, but they can't biopsy because it's not amenable. So because of this, despite your reassurance that the lesion looks benign, Melanie develops severe anxiety, quits school, starts medication, and goes on disability. We're all familiar with examples like this. But then why is overuse so prevalent? We're all trying to do the best thing for our patients, but there are often many subtle and often subconscious systemic, personal, and patient-related factors that nudge us towards certain actions, despite limited evidence that patients will benefit. Becoming more aware of these drivers allows us to be better prepared to recognize and avoid being influenced by them in our own practice. If we were to cull all the unnecessary and harmful care, that would be a huge reduction in our carbon footprint, along with improved patient outcomes, less work for healthcare providers, imagine a test box 30% smaller, and less cost to the system. So responsible resource stewardship is actually one of the keys to environmental sustainability. In summary, lean service delivery is all about rethinking and reducing unnecessary waste in the system. There are already many great resources available, most of them designed to reduce costs in the system and improve patient care, such as choosing wisely, but we can use the same tools to help reduce our environmental impact. There are also great examples out there of organizations that have already made changes to reduce the physical waste in their practices, like eliminating exam table paper from their clinics. Some people might worry that careful resource stewardship like this could be perceived as a form of rationing, which may not be consistent with patient-centered care. However, from an ethical perspective, the principles of justice for the population, as well as doing good without doing harm, all outweigh the principle of patient autonomy when it comes to avoiding low-value care, particularly if you also include the concept of environmental and intergenerational justice. But of course, understanding individual patient values is essential in helping determine the care that's appropriate. What might be low-value care or inappropriate care for one person might be perfectly appropriate for someone else. This second domain in the UK framework, engaging patients in care, recognizes that it's important that, especially as family physicians, we have the opportunity to learn about what matters to a patient and how they prefer to deal with health concerns. When we take the time to explain clearly the benefits and potential harms of different interventions, obtain fully informed consent, many patients will opt for less rather than more care. Involving patients in managing their own health care through increased self-management when appropriate is another empowering way to engage patients. A great example of a decision aid for helping patients understand the benefits and harms of using medications is one of my favorites, the CBD risk calculator. I find that patients love this tool, and it really helps them see the absolute benefits and risks of treating their blood pressure, cholesterol, or not, or in showing them the benefits of lifestyle changes. And there are many other similar tools available for other conditions. The third domain from the UK framework is health promotion and disease prevention. Obviously, if we're successful in keeping people healthy, they'll require less resource intensive healthcare later on. An ounce of prevention is probably worth many tons of CO2 saved. The last category is identifying low carbon or low greenhouse gas alternatives in the care we provide. One of the best examples of this is metered dose inhalers, which have an aerosol propellant that's a powerful greenhouse gas, while the alternative, dry powder inhalers, have a much smaller footprint. Switching many patients to dry powder inhalers is a simple thing we could all do immediately. Another low carbon alternative approach is to look for reusable products, which generally have a much smaller environmental impact than single-use disposable products, even when considering the cleaning and processing required. Even though little attention has been paid to primary care so far, it's a critically important piece of the puzzle when we're thinking about environmentally sustainable care. As family physicians, we're ideally positioned to do prevention and health promotion and have those value-based conversations with our patients due to our longitudinal relationships with them. Unlike those working in other settings, we can make simple, low-cost changes in our practice overnight or over conversation with colleagues in the coffee room. Without the bureaucracy of large hospitals or health authorities, and with our numbers, we could have a huge impact if we all made even small changes. Because we're gatekeepers to the rest of the system, if we're careful about our own practice, it can limit the cascading effect of more and more unnecessary investigations and referrals and reduce the impact on other parts of the system. With all that's been happening in healthcare lately, I think we all really need some good news. There's certainly a lot that needs to be done, and our leaders have an important role to play in addressing these issues. But doing this work has been really inspiring for me because I can see so many things that we can each do individually every day that can help move us in the right direction as well, for the future of the planet, but also for our patients, the system, and for ourselves. So to finish, I just want to share quotes from two of my favorite characters, the Lorax you all know. Unless someone like you cares a whole awful lot, nothing's going to get better. It's not. And now I know all of you care a lot. That's why you're in this profession. And I know we all want to do the best thing for our patients. The other one is something my dad always said to me. I realized later it wasn't his original quote. It belonged to somebody else. I'll go back here. It's a powerful string of two-letter words that has always inspired me. If it is to be, it is up to me. And I think of it now when we're all trying to figure out how to deal with this problem, all these challenges we're facing in healthcare. But I really do think that, at least if it